And good morning to you. This is TDT Live. I am Stacey Ann Providence. The Ministry of Health is giving an update on the status of COVID-19 here in Trinidad and Tobago, and we're bringing you live coverage on TDT, Talk City 91.1 FM, Suite 100.1 FM, Next 99.1 FM, and on Facebook at TDT Live Online. We go now to the Manager of Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning, Trinidad and Tobago, and happy International Women's Day. And I see, like Miss Providence, I'm wearing a touch of purple. I hope we all have a little touch of purple on us, or at least in our minds today. Thank you for joining us for another Ministry of Health virtual media conference on the COVID-19 response. Our panelists today are the Honorable Terence Dayal Singh, Minister of Health, and Dr. Miriam Abdul-Richards, Principal Medical Officer of Institutions. I'm Candice Alcantara, Manager of Corporate Communication for the Ministry of Health, and I will moderate this morning. We go straight to the clinical update from Dr. Richards.
Thank you ever so much, Ms. Alcantara. Good morning to the Honourable Minister. Good morning to the distinguished members of the media. Thank you so much for your continued attendance at these media conferences. Good morning, Trinidad and Tobago, and happy International Women's Day as we choose the challenge to fight against the COVID-19 pandemic. This morning, I will be focusing on two areas: a summary of the parallel healthcare system as per the media release number 656 on the 7th of March 2021, and the statistics or clinical status of ongoing repatriation exercises. As of 4 p.m. on the 7th of March 2021, 98,965 COVID-19 tests were done. Yesterday, there were 4 confirmed cases of COVID-19, bringing the number of active cases to 98. It is important to note that these positive cases represented the time period between the 4th and 6th of March. The remaining 94 active cases can be accounted for as follows. There are 77 persons in home isolation, 5 persons at the day-based step-down facility, and 12 patients in hospital. Of these 12 patients, 8 are at the Couva Medical and Multi-Training Facility, with 6 at the ward level and 2 at the ICU level, while 4 are at the Scarborough Regional Hospital. All patients at the Scarborough Regional Hospital are at ward level. Thus far, the number of persons as of 8 a.m. in state and state-supervised quarantine facilities is 477. We have had, unfortunately, 139 deaths, and of course, we express our sincere condolences to the families of the deceased. There are 2 repatriation exercises that are scheduled in the next week. A repatriation exercise from Barbados to Trinidad is scheduled for the 10th of March 2021, while a similar exercise is scheduled for persons returning from Miami, United States of America, on the 13th of March 2021. 3 exercises were carried out last week with the repatriation of almost 250 returning nationals. In spite of the Government of Trinidad and Tobago comprehensive and overall successful implementation of policies and plans to keep Trinidad and Tobago safe, I would like to appeal to each one of you on behalf of the Ministry of Health to practice the 3 W's. Let us not become cognizant. Let us wash our hands, let us wear our masks properly, and let us watch our distance. Yes, we will have a vaccine soon, but given our rolling averages of 3 cases per day as of this week, and additionally our very low hospital occupancy rates, which continue to proceed on a downward trend, that is an overall hospital occupancy rate of 3%, ambulatory occupancy rates of 3%, HDU of 0%, and intensive care unit rates of 5% and decreasing daily, we need to continue practicing our public health measures. The WHO Director General actually recognized the efforts of the population and the government of Trinidad and Tobago in his recent address, where he emphasized the importance of public health measures and vaccination as an additional tier in the response to the COVID-19 pandemic. Let us continue to exercise personal responsibilities to keep ourselves, our families, and our population safe. Let us continue today, ladies of Trinidad and Tobago, to choose to challenge this COVID-19 epidemic. Thank you very much.
Thank you very much, Dr. Richards, for that update. And we go now to a statement from the Honorable Terence Deyalsingh, Minister of Health.
Thank you very much, Candice. Good morning to Dr. Richards. Good morning to ladies and gentlemen of the media. Good morning to the public, and especially to our women today on International Women's Day. And the theme for International Women's Day in Trinidad and Tobago could not be more apt. Women in leadership, achieving an equal future in a COVID-19 world. And yes, the world really has changed a lot since the last International Women's Day. So I salute all women this morning. And yes, Candice, I do have my little piece of purple in my tie this morning. Okay, I would like to bring the population up to date on where we are with vaccines. You may recall the last time I briefed the country on procurement of vaccines would have been last week, Saturday. At that time, I would have indicated that COVAX would have signed off on sending to Trinidad and Tobago in the initial stages 100,800. To do that and to bring us to that point, we would have had to sign off on the COVAX agreement, which we did in September 2020. I would have had to go to Cabinet for indemnification, which I explained last week, Saturday. That was done. The next stage was to get the price estimate, which we did last week. And then what had to follow was the actual quotation, so we could pay into the PAHO revolving fund the actual monies. What I can tell you is that we actually got the quotation last week, Friday. And what PAHO has indicated that they are going to split the shipment into maybe 2 parts. So they gave us a quotation and these vaccines, all things being equal again, will arrive by the end of March. So they gave us a quotation for 33,600 doses at a cost of $148,084.06 US. That money left the Ministry of Health on Friday afternoon. It has gone to the central bank, and between today and tomorrow, those funds will be deposited into the PAHO revolving fund. That is the last step on our end. It means now we just wait now for delivery of the first tranche of our 100,000, which we are guaranteed at this stage of 33,600 to begin our vaccination program. And then the rest of the vaccines will follow as originally stated between March and May. So we were allocated 100,800 according to PAHO between March and May. We will be getting 33,600. We decided to go this route and not to wait for the entire shipment, because you never can tell what could happen, and an entire shipment might be delayed. So we are very happy to be receiving 33,600, and the balance of 67,000 will come, I am told, sometime in April into early May. With this 33,600, it means we could start a more vigorous campaign of vaccinating our healthcare workers. There's one population that we want to finish off, that after healthcare workers will be the elderly in long-stay homes. It's roughly about 987. So we could do that entire population and then start, according to the COVAX basis on equity, start to deal with some of our NCD patients. So we have done everything on our end, and I'm happy that we have decided, we weigh the pros and cons of accepting 33,600 or waiting for the entire shipment. We felt at this stage, with things being so uncertain in the global scene, with supply not being able to keep up with demand, that it is better to take this first tranche of 33,600 and begin our vaccination program. We are also in talks, and those talks are going on right now at the ministry with the chief medical officer and the principal pharmacist with Sinopharm. Sinopharm's dossier with their phase 3 trials, I was informed this morning, is currently before WHO. So that is good news again. It means there's a potential for a fourth WHO vaccine to become available. And as you know, we have been in talks with the Chinese embassy here since last year and Sinopharm since last year. So we have our foot in the door for that potential source of vaccines. We also continue to host bilateral talks with Serum Institute of India. We are also having bilateral talks with Bharat Biotech of India again for the Covaxin vaccine. But again, we will only be importing vaccines into Trinidad and Tobago once they are WHO certified. So the Ministry of Foreign Affairs and the Ministry of Health are working together on these diplomatic channels to acquire vaccines for Trinidad and Tobago. Another development is that at the start of January 2021, I had indicated that if our case numbers continue to be low, as they have been, a rolling 7-day average of between 3 to 6 is a very good place to be. I did indicate that it means I could take a Rima hospital off the COVID grid and return it to its original mandate. That is now being done. So I want to thank Trinidad and Tobago for working with us at the Ministry of Health. Because our numbers are so low, because we are so well protected, we are able now to take a Rima off the grid and return it. We are also pursuing very vigorously the procurement of vaccines out of the African Medical Council's platform. We are registered as a purchaser. We were initially told we could purchase 226,000 doses. That has since gone up significantly across 3 vaccine platforms: AstraZeneca, Pfizer, and I think it's, I can't remember the third one. AstraZeneca, Pfizer, and a third one. But we have significantly upped our request for vaccines, now up to 446,000 via the African Medical Council's platform. Again, we are waiting for price estimates and estimated times of arrival. So that is where we are. We eagerly await. We have paid for. We have paid 148,000 US dollars, $148,084.06. As I said, those funds should hit PAHO's revolving fund account between today and tomorrow, and that is the final step towards the acquisition of our first tranche of the 100,800 doses of AstraZeneca vaccines to really start making a dent in our vaccination program. So Candice, that's the update this morning, and thank you, and we look forward to answering your questions.
Thank you very much, Minister Dayal Singh. We go now to the question and answer segment. I invite media representatives to indicate your name and the media house that you represent before posing your brief questions. Please, no more than 2 at this time, and please ask both questions at the same time so we can keep things rolling. If we have additional time, of course, we will come back to you if you have an additional question. We begin this morning with questions from Newsday newspaper.
Hello, good morning, Minister, and everyone on the panel, as well as Trinidad and Tobago. Happy International Women's Day. 2 quick questions. First, concerning the 33,000 vaccinations, what is the plan, first of all, with distribution of the vaccinations? Will half of these vaccinations be used and then the other half stored in preparation for the second tranche? Or will we be using the full tranche in expectation for another 33,000? The second question would actually deals with Canada. Canada cleared Johnson and Johnson last week for about 4 vaccines. I want to know if bilateral talks with Johnson and Johnson, which the ministry has indicated, has that progressed as well.
Thank you, Ryan. And those are 2 very reasonable questions to ask. So, the 33,000, if it's a 2-shot vaccine, it means you are vaccinating roughly, let's say, 15 to 16,000 persons. That could take care of all our health sector workers. The CMO, myself, and we will sit down with PAHO. And once we know for a fact when the other 67,000 doses are coming in, we could take a decision to go full steam ahead and use out all 33,000. But that is a decision we will make sometime in the future, but it's a good question to ask. As a matter of fact, it's a nice problem to have. On the issue of Canada, yes, I note that Pfizer, Johnson & Johnson, that was the 3rd vaccine out of African Medic. Yeah, it was Pfizer, Johnson & Johnson, and AstraZeneca. Thank you, Ryan. Yeah, so we are still awaiting WHO's approval, and as you know, any country that approves a vaccine lends more credible evidence. So if it is approved by FDA, that is good. If it's approved by Canada, that is good. If it is approved by the European Medicines Agency, that is good. If it is approved by Health England, Public Health England, that is good. It just lends more and more credibility to the vaccine. But our tipping point in Trinidad and Tobago has always been WHO certification. And yes, we are in talks with Johnson & Johnson at various levels. So thank you, Ryan, for your 2 really good questions.
Thank you. We go now to AZP News, please.
Hi, good morning. Harry, AZPnews.com. Good morning to everyone, especially to Candice and to Dr. Abdul Richards.
So
okay, my first question, I wanted to find out if it has been categorically stated that Nurse Privat Gomez was actually the first one to receive the vaccine, because there are reports that Dr. Malcolm received the vaccine 1 hour before Nurse Privat Gomez. Now the issue is really not who actually received the vaccine first or second. The point is whether the population was misled into believing something that was not true. So I just wanted to get that clarified.
Okay, so prior, yeah.
I think he has a second question.
Sorry.
Mr. Bihari, you have a second question?
And my second question to Minister Dial Singh, there was supposed to be a function on Friday last at Woodford Square by the Candlelight Movement, and they refused permission. The official reason that was stated by one of the members, Philip Alexander, he said that there was a mix-up between the CMO and the mayor of Port-of-Spain. So I just wanted to find out why the movement was refused permission on Friday when there was a similar function held on February 12th at the same venue, but they were refused the use of Woodford Square on Friday going. So I just needed to get that clarified. Okay. Thank you.
So thank you. So prior, the issue that you have raised in your first question, you have raised already. The information I have is that Nurse Privat was the first, but if you have other information, that's fine. The issue as to the function in Woodford Square, I really don't have much information to add to it. Hosting of functions in Woodford Square, I suppose, falls under the corporation, Port-of-Spain Corporation, and if you have to have permission from the police and so on. But I just want to remind the public, as Dr. Richards has stated, what is happening in Trinidad and Tobago, because our numbers are so good, people are being lulled into a false sense of security. Yes, we are doing well, but we are doing well because we are conducting ourselves in a responsible manner. Every congregation, whether in the public domain or in the private domain, Dr. Janine St. Bernard was here last week talking about the number of positive cases she is getting in County Caroni based on private parties. So the messages, any gathering, whether inside or outside, has the potential to spread COVID. Trinidad and Tobago is not COVID-free. What we have done is done a very good job, led by the Prime Minister, with the involvement of 1.4 million people working together as a team to bring Trinidad and Tobago to a point where we can report to you today that we have a rolling average of 3 to 4 cases. That is something we should celebrate, but in celebrating it is a position we should seek to protect. Let's protect that position by all adopting a sense of responsibility. But as to the particulars of Woodford Square, I wouldn't be in a position to talk to that. You could talk to either the Commissioner of Police or the Mayor who has domain over Woodford Square.
Thank you, Minister. We go now to 98.1 FM, please.
And a very good morning to the panel, and happy International Women's Day to you, Ms. Candice, and of course Dr. Richards. Just 2 simple questions for Minister Dayal Singh. I was going to ask you about, giving us an update on our, the latest report on COVID-19, a vaccination drive, but you did address that in your opening. However, Minister Dayal Singh, do you have any realistic timeline or projections when we can possibly see Trinidad and Tobago achieving herd immunity in the continuation of our vaccination process? And secondly, to you again, Minister Dayal Singh, there was an earlier report which stated that there was a temporary stoppage in the administering of COVID vaccines to an initial group. Any further developments on this? Thank you so much.
Thank you, Mr. Cummings, and I haven't seen you for a while. Well, welcome back. So let's take your second question first. I am not aware of what stoppage you are referring to. Would you like to explain the stoppage of the vaccinations that you're referring to, sir?
Mr. Cummings, I think you may be muted. Just unmute your mic for us and start over. Thank you.
Yes, I was aware that there was a temporary hold on the administering of vaccines. I think some were being held back for a future purpose. I just wanted to get some clarity on that.
Sure. I understand, issue. So it's not a temporary stoppage, Mr. Cummings. It is a policy position that we took that because that the AstraZeneca vaccine is a 2-dose vaccine, whatever amount of vaccines we get, especially if it's a limited amount, you vaccinate a half of that number, and then you hold the other half so that those same persons get their second dose. So it is not a stoppage. It's a policy position that when you reach a half, as I have stated publicly, that you hold back the other half for those same persons. So that is what we have done, right? On the issue of when we will reach herd immunity, as we have said, herd immunity depends on vaccinating up close between 50 to 70% of your population. Dr. Richards will go into that in some detail. But the question you ask as to when, we cannot give a date because simply we are not in complete control of the supply of vaccines. So it is only when the world, and I want to refer you, Mr. Cummings, to a very good article written in one of the Sunday's newspapers. Anybody can remember which one? I think it could have been the Express. A very good article on the Sunday Express, which speaks to 2 things. 1, the global fight for vaccines. 2, the fact that 1 or 2 countries are now suing COVAX because they can't get vaccines. And 3, the article did mention the fact that because our numbers are so good, which we spoke about before, you may find that Trinidad and Tobago may be disadvantaged because of that. So acquiring herd immunity depends on a series of factors: supply of vaccines, whether COVAX can deliver, the success we will have in bilateral talks. The Prime Minister of the Republic of Trinidad and Tobago and CARICOM chairman has called for a world conference on the equitable distribution of vaccines. Because what is happening now, Mr. Cummins, is an inequitable distribution of vaccines. You have the richer countries, bigger countries where the vaccines are being manufactured, having more vaccines than they need. And if you pay attention to what has happened between Italy and Australia, which was again carried in that Sunday article yesterday, there was a shipment of vaccines manufactured in Italy bound for Australia, and the Italian government took a decision that they were not going to allow the shipment to leave Italy. So there are so many things happening globally, politically, economically, on the vaccine procurement front. But we are happy that we have paid for our first batch of 33,600 vaccines, which, all things being equal, as I always say, should be here by the end of March so we could start our own robust vaccination program. I don't know if Dr. Richards wants to talk about herd immunity now.
I'll just summarize and reiterate what the Honourable Minister spoke about. But in terms of herd immunity, we are looking at a percentage coverage from the population of about 75%. And I'd like to remind members of the population and encourage, empower, and educate everyone with respect to receiving the vaccine. The vaccine does not just protect you from developing or contracting COVID-19, it also protects persons who are high risk and your family, especially children and pregnant women. It decreases their risk of contracting the COVID-19.
Thank you very much. And we go now to Wired 868, please.
Hi, good morning, everyone. Fayola Bostic, Wired 868. I have just two quick questions today. My first question is for Minister Diyal Singh. Minister, when we thought we were going to get the 100,000 at the first, it was beginning of March, and now it's the end of March, maybe April. Could you just give us a sense of how this procurement works? Does COVAX have a facility where it accepts and separates vaccines bound for certain countries, or is it coming from directly the manufacturer? I'm just trying to get a sense of why there would have been these delays and why we would need to split the shipment now. The second question is for Dr. Richards. Dr. Richards, can you let us know if how repatriation flights, if they've been increasing, decreasing, or what is happening in terms of repatriation flights, given our low numbers and given the state that we're in right now? Thank you.
Okay, thank you, Fiola. So as I said at the start, there is an absolute shortage of vaccines around the world. Supply has not yet caught up with demand. The COVAX facility is based on the whole issue of equity, and it is in the public domain. A lot of the major vaccine manufacturers prefer to sell their vaccines on the commercial market at prices much higher than the COVAX facility. Our vaccines, our AstraZeneca vaccines, are coming from South Korea. That is what I was told by PAHO. It's called the SK AstraZeneca. And they have to weigh the fact that they are not getting enough vaccines as promised. So I would imagine that that is a choice that they have to make. And we are still very, very grateful that we are getting an initial 33,600 towards that 100,000 dose regime between March and May, so we could start a very vigorous vaccination campaign. So the reason for the split shipment is sound. It was either that or wait for the whole 100,000, and you never could tell what could happen. So we took a decision at the Ministry of Health to go with this, and then I am dealing directly through PAHO with Washington to get certain guarantees, and we continue to push Trinidad and Tobago's case around the world, notwithstanding our low case numbers, that we are a sound place for vaccines to reach us so we can vaccinate our population. Thank you very much, Fayola.
Good morning, Fayola. As is customary, I would like to re-emphasize that the approval for nationals and others to enter Trinidad and Tobago falls under the Ministry of National Security. However, what I would indicate is that the Ministry of Health continues to support the Ministry of National Security, as the return and the safe return and accommodation of all repatriated nationals is a government priority. Regarding the flights that you would have discussed, the number of repatriation flights continues to be at intervals of basically 8 to 11 days. The returning repatriated nationals from Barbados, however, undergo a quarantine period of 14 days under state or state-supervised quarantine, as opposed to persons returning from other countries, such as the United States of America and Canada. That is because of the prevalence of the new strain of COVID-19, one of the new strains, in Barbados. As such, the Barbados repatriations tend to be spaced out at about 16-day intervals to allow for the safe accommodation of returning nationals. What we have noted over the last 3 months is that we are seeing 80 to 90% acceptance of persons who are approved for exemptions to enter Trinidad and Tobago. As such, a repatriation flight now consists of about 100 to 120 persons entering the country. Again, the spacing and intervals of those flights continues to be at about a 10-day spacing, dependent on the Ministry of Health's availability of accommodation. And the sites or the departure ports for those flights continue to be out of Miami, New York, Toronto, and Barbados, with flights basically led between at Guyana, Grenada, and other countries. The variant in Barbados really is, or the variant that is present in Barbados is the UK variant, and in trying to protect our country from this variant, we really extended that quarantine period for persons so that they are monitored and tested to reduce the risk of the variant being here.
Thank you very much, Dr. Richards. We go now to CNC3, please.
Hi, morning, everyone. Rashad Khan, Guardian Media Limited. Okay, so my first question, Minister, is I just want a little bit more clarity. So it deals with the vaccination drive. Is it that when we're doing our phases, phase 1 and phase 2, considering the difficulties in which we have in acquiring doses, is it that we're going to go to each category, and when that category is completed, then we move on to the other one? Or is it that we're going to just go across all the categories of people who need to be vaccinated? And my second question is to you as well, Minister. A number of people have been emailing and contacting us, wondering about if they have NCDs or if they fall within any of these categories, but they don't treat it through the public system. How can they access the vaccinations?
Thank you, Rashad. Again, those are quite important and reasonable questions to ask. So, again, it depends on the number of vaccines you have at your disposal. If you have 100,800 doses that we expect between March, April, and May, it will be done mainly sequentially. That is, healthcare workers together with the persons in long-stay homes, as I indicated, roughly 987. And then we start to tackle, as we have always said, the NCD patients in our health sector. If the supply should open up and we should get 500,000, 1 million doses, then we could look beyond doing things sequentially and then open up the entire system. We already have plans in place for mass vaccination sites, working with the Trinidad and Tobago Medical Association, so that anyone could access vaccines. But it all depends, Richard, on the number of vaccines we get at any one point in time. So if vaccines are not plentiful, it is going to have to be sequentially. So in phase 1, healthcare workers, persons with NCDs, and our elderly in long-stay homes. Phase 2, as we have always told the public, we then go down to essential workers. Who are some of the categories in essential workers? Frontline police, frontline army, frontline Coast Guard. Teachers, especially those who are now out. It is based on the principle of high exposure, high vulnerability. So a Form 5, 6, Form 4, 5, and 6 teacher is more highly exposed than the Form 1 teacher who is at home. So it's based on that same word called equity, high exposure, high vulnerability. Then you might want to do fire, you want to do immigration, you want to do customs. I have included parliamentarians in that group, and that is how we stratify. However, as I said, if vaccine supply starts to pick up, then we could look beyond stratification. We could look beyond doing things sequentially and do different groups concurrently, including the general public. I hope that answers your question, Richard.
And the second question, Minister, for
well, the same thing with
okay.
NCD. So, anybody with an NCD, it depends on whether we do it sequentially based on a certain number of vaccines or just go across the board.
Thank you very much, Minister. We go now to TV6, please.
Good morning, everyone. Urvashi from TV6. Happy International Women's Day. Minister, I'd like to find out which vaccines are being considered for approval by the Food and Drug Division and the status of it, how soon as well, because from what I understand, that may allow persons, private entities to now import the vaccines, right? That's question 1. Question 2, we saw one regional conglomerate, they issued a statement indicating that they intended to vaccinate all of the employees across different islands of the region. I think it's about 6,000 in all, and I think that they also indicated that they would have spoken with governments to be able to facilitate this. So I'm asking if the government, the Ministry of Health, via the government via Ministry of Health, has engaged in any discussions with Ansa McCall regarding the vaccination of their employees, one. And isn't this counter the principle of equitable access? Thank you.
So I'll take a second question first. You assumed that we have partnered to do that, and we have not, because I addressed the same question, Urvashi, 2 weeks ago. Any vaccine, any importer is free. Let me go back. The only vaccine approved by Chemistry, Food and Drugs right now for Trinidad and Tobago is AstraZeneca. Johnson & Johnson and Pfizer are not yet approved. The local agents will have to make that approach. And as I have said, for any drug, any local distributor goes to Chemistry, Food and Drugs. There's a drug advisory committee that sits and approves drugs. It's the same process to approve any new vaccine as we have been using for decades to approve new drugs. So at this particular point in time, only AstraZeneca has been approved because the government made an approach to Chemistry, Food and Drugs, not the local distributor, because it's not available for private sale as yet. To answer your specific question, the government, and I have said this before, has made no provision to give any private sector firm vaccines for their staff alone. So let me say that again. The vaccines coming in through COVAX are assigned to Trinidad and Tobago. The consignee is the Ministry of Health / NIPDEC. It does not pass through any local agent. any third party, any local pharmaceutical distributor. And that is the way PAHO has always dealt with Trinidad and Tobago for 40 years. I know people think that we are now doing this for the first time. All the vaccines we buy via PAHO, all, whether it's yellow fever, MMR, tetanus, all vaccines that we purchase from PAHO are consigned to the Ministry of Health and NIPTEC. They don't pass through a third party. They don't pass through a local distributor. They don't pass through a middleman. So I want to say that, and again, so I thank you for raising the issue. However, as I have said many times before, there will come a time, sometime in the future, when supply catches up with demand, and then the vaccines start to become commoditized and available on a commercial basis. At that point in time, the local distributor can make an application to Chemistry, Food and Drugs, as they are accustomed doing for 40 years, to bring in a new drug. There's a drug advisory committee that sits under the chairmanship of the chief medical officer. They do their work. Once the drug is approved, the Minister of Health, whosoever he is, signs off on it. At that point in time, any private sector firm is free to purchase vaccines on the commercial market. But any vaccines that we get via COVAX, African Medicine Council platform, or any bilateral talks between the government and another government, or the government and another manufacturer, will not be going to the private sector, but will be made available to the public. So, Urvashi, thank you for raising the issue again, and I hope that answers your question.
Thank you, Minister. We go now to Express newspaper, please.
Hi, good morning, everyone. Kenny Fletcher, Trinidad Express. Now, my two questions this morning is for Minister Singh. My first question is based on international reports coming out of Austria. The Austrian government have suspended the use of AstraZeneca shots based on two instances of two persons. One, there's a death, and the other person was hospitalized with adverse events after taking the AstraZeneca vaccine. They were two female healthcare workers. So my question is there now a cause for concern, seeing that we are about to receive the AstraZeneca vaccine and we are beginning with vaccinating our healthcare workers? That's my first question. And the second question, the yachting industry, they would like to have an update on whether they'll be allowed to open up for their foreign yachts to come in. They said the last update they received is that Minister Young want to speak to you on that matter.
Okay.
Thank you.
Thank you. So on the issue of the Austrian case, we will continue to be led by the science. At this point in time, there is no conclusive evidence linking the death to the vaccine at this point in time. So whilst we pay attention to these things, there is no conclusive evidence. One. Two, the issue of opening up the yachting industry. As you know, I have said on this platform many times, I don't make policy on air because a question is posed. The issue of opening up the yachting industry is one that will be made jointly by the Ministry of National Security, the Ministry of Health, and all rollbacks of measures are always announced and eventually decided upon by the Honorable Prime Minister. So I, as Minister of Health, are going to be very consistent in my approach. I don't make policy just because a question is posed to me on air. I understand and I empathize with all sectors, those few sectors of the economy that are still closed. Believe me, we understand. But the issue of variants around the world has thrown a spanner in the works. And again, I want to urge all, because we have a rolling average of 3 to 4 to 6 cases a day, does not mean that we lose all these gains by making decisions which may make you popular in the short term, but which can have long-term consequences. I empathize with everyone who still cannot open as they would like. But the gains we have made, we have to do two things with those gains. One, celebrate them, thank the population, but two, most importantly, we have to protect those gains. We have to protect those gains. As Dr. Hines will say, when you have high blood pressure or diabetes and you start to take your medication, you start to feel good. Doesn't mean when you start to feel good, you stop taking the medication. And that is what we are constantly being pushed to do. We have applied a certain degree of medication to the country, and we are feeling better. We are feeling good. But now is not the time to stop taking the medication, and then the country has to go back to accident and emergency because we lost all the gains that we made. I understand the cries. I myself spoke to the Yotan, I want to call his name because I don't have permission to do. I myself spoke to him. But at this point in time, I cannot make a decision on air. Thank you very much.
Thank you very much, Minister. We go to a quick follow-up question from AZP News, please.
Good morning again. I want to follow up again on the issue of the conservation groups who deal with the turtle nesting, Minister. Beaches are closed at 6 p.m. and most of the turtles, they do nest at night. And they were wondering if some exemptions could be made for them to, continue to operate, of course, adhering to the COVID-19 protocols.
So Prior, thank you for the question. Two things. Now should possibly be the safest time for turtles because no one is allowed on the beach to poach eggs or to kill the turtles or ride on their backs. So now should be the safest time for turtles. But Prior, I just gave a very, very detailed response to why we can't open up the yachting industry on air. The same principle applies. If we start to make one exemption, one exception, then I get 10, 20 letters a day for exceptions and exemptions, and everyone could be justified. But you do one, you have to do all. And then the gains we have made Prior, the gains that we have made, we will lose them. And people will start to die of COVID. Our elderly will start to die. The best way we could prevent Trinidad and Tobago from being readmitted to the accident and emergency ward is to continue to take the medicine, although we feel good. It's the same analogy with high blood pressure and diabetes and antibiotics. When you go to the doctor and he gives you a 7-day course of antibiotics, the first thing he tells you, you will start to feel good after 2 days, but take the course. We are on a course that is saving lives. Look at our hospital rates. Our hospital rates are low. Our normal hospital services go on unabated. That should be celebrated, but I always also say it should be protected. We have to protect these hard-fought gains. We don't want to go back to September. You remember those days Prior when we had community spread? That is what the calls for just releasing everything will do to us. Let us protect lives, protect the gains, protect the businesses that are open, and protect the businesses that want to be open. So I hear the calls. I am sympathetic, but at this point in time, we should be protecting the gains that we have made so that when we get our vaccinations and start a vaccination program, then these issues could be entertained in a more robust manner. Thank you very much, Prior.
Thank you very much, Minister. We go to Wide 868 for a brief question, please.
Hi, good morning again. My question to the Minister is concerning the vaccination shipment again.
Sure.
I'm wondering what triggers the sending of the quotation and the paying of the bills, because we were expecting the 100,000 vaccines for some time, but we only recently received the quotation and paid. That's what I'm understanding that you're saying, right? So I'm wondering when, what would trigger the sending of the quotation for the second half, the 67,000, and whether or not, would it make sense to pay down now for it, or why would you wait till April, May to pay again? Or what would trigger that that quotation to come?
Yeah. So, Fiola, you have asked a question that we at the ministry have raised with PAHO, and we have offered to pay upfront. We have actually made that offer to pay upfront, and they are looking at it. We made that offer last week, Wednesday or Thursday, I believe, and they are looking at it so that we could secure the other tranche of $67,000. So I thank you for raising the issue, and you and I are thinking along the exact same lines. So thank you very much.
Thank you, Minister. CNC3, we're ready for your follow-up question, please.
Hi, thank you again. Just a quick comment from Minister or even Dr. Richards. So Dr. Richards, in your explanation there just now, you said that we're looking at around 70 to 75% of people for herd immunity in the country. But by way of the exclusion criteria, so those who are nursing, pregnant, the young, and that kind of thing, by our calculations, it's around 26% of the population may not be able to receive that vaccine. So how do things like vaccine hesitancy or vaccine skepticism or even outright anti-vaxxers, how do you figure that is going to play into the ministry's medium to long-term plans for that generation of herd immunity?
Okay, I will attempt to answer that. So right now, the exclusion criteria excludes about 400,000 persons from the population. So we have 1.4 million people. The exclusion criteria right now is anybody under 18. So that takes off roughly 400,000. Pregnant women, that will take off in any given year 15,000 persons. Persons who are allergic, a small amount. But let's work with 400,000. What will change that dynamic, Richard? And again, I'm really grateful for the questions being asked this morning. They are all very, very good questions. The companies are now starting clinical trials on persons under 18. They are now starting clinical trials on pregnant women. Why? Because they now have some data in the pregnant women of women who did not know they were pregnant but who got the vaccine, and they're being monitored throughout their pregnancy. So you will get some data in a few months stating whether the vaccine is actually safe for pregnant women or not. So that is one population you will get data on. Because over 150 million doses of COVID vaccines of all the platforms, and it's probably more, have been administered around the world with very little adverse effects, they are now starting trials in children. And then when you get that data set in a few months, that will go to WHO. Hopefully by that time, we could determine, based on what the data sets say, that the vaccine is safe for children, and then we could, based on the data sets and WHO's independent approval process, how it works is that they will make a determination. On the issue of vaccine hesitancy, I could tell you, Richard, we are pleasantly surprised at the level of vaccine acceptance in Trinidad and Tobago. We were concerned that the first 2,000 doses, we will have to really sell it to healthcare workers. But I always go back to the symposium we did at UE. Candice, when was that?
The 7th of
February. And then the internal work we have been doing with the RHAs, with healthcare workers, has led to a very high degree of vaccine acceptance. And members of the public are now clamoring for the vaccine. So I am buoyed. I am happy at the level of vaccine acceptance in Trinidad and Tobago. But thank you for those two questions.
And next we go to TV6, please.
Minister, thanks again for the opportunity. Just to find out a little bit about the payment to the COVAX facility. Now, we know that government would have, the cabinet note with regards to 66 million to vaccinate 33% of the population. We're getting 20% of the vaccines required from COVAX. A down payment had been made. If you could just give me some clarity on if a down payment had been made to COVAX, and this 148 thousand US dollars is for the 33,600 vaccines.
Sure.
Could you just break down the pricing for me? Thank you.
Yeah. Again, thank you for the question. So, government, all member countries to the COVAX facility had to make a down payment which went towards research and development. Because you had pooled resources for research and development funding, it is one of the reasons that the vaccines were able to be developed so quickly, because you had pool funding. Companies didn't have to go out there and look for grant funding and beg for funding and go to foundations for funding. We paid $1.477 million US dollars upfront towards that R&D effort. Let me give you some details which I will share with you now to show how, in theory, if we all support COVAX, it could work to our advantage. In September, we had no idea of what the final price of vaccines would be. So in September, the cabinet note, based on COVAX's estimated pricing, spoke to an indicative price of $10.56 US per dose, with an escalation double that up to $21 US per dose. That is what countries signed up for back in September, not knowing what the final price will be. So look at that price, $10.56 with an escalation up to $21, double. The actual price we are paying now for these vaccines under COVAX, and this is the brilliant thing about COVAX, if we could all adhere to it, it's below $4 US. So whilst in September, the cabinet note spoke to 10 US with an escalation up to 21 US where you could opt out, because 21 US per dose is a lot of money when you consider it's a 2-dose vaccine. But right now, we are paying via COVAX under $4 US a dose. And that is the brilliant thing about the principle of the COVAX facility. And what we have to do as a world economy is to try and support the COVAX facility, because it means many more countries can afford the vaccines at a cost of $4 US, as opposed to an indicative price of $10 US up to $21 US. So that is how the pricing works, Urvashi. The actual payment, as I said, we always pay for vaccines we acquire from PAHO through something called the revolving fund. This has been done for decades. The same principle applies. The Ministry of Health receives a quotation. The Ministry of Health sends the funds down to the central bank, and the central bank forwards it to the PAHO revolving fund. That should be done between today and tomorrow, and that's the final hurdle we have to cross to get our vaccines. And I think Fiola had asked, yes, we are exploring making upfront payments to COVAX to secure our future shipments of vaccines. So I hope I have given you a complete answer to a very good question.
Thank you, Minister. And we just have a little minute left. Newsday, a very quick question, please. Our last question this morning.
Okay, last question. Concerning the UK strain of COVID-19, we had one repatriated national who had it. I just wanted to get an update on his condition and if there were any other repatriates or anyone else, in fact, that showed that strain.
As confirmed publicly, there was one repatriated national with the UK variant. However, due to patient confidentiality and ethics that we abide by with the Ministry of Health, at the Ministry of Health, I would be unable at this time to provide an update on the person's clinical update status. Thank you.
Thank you very much. We have come to the end of this morning's media conference, and we remind everyone, please remember the 3 W's. Wash your hands, wear your mask, and watch your distance between yourselves and others outside of your household bubble. Everyone be safe and enjoy the rest of the International Women's Day.